Prime Minister Zandanshatar has urged the leadership of the Ministry of Energy to operate under unified management, policy, and principles. In light of recent developments, state-owned thermal power plants have been placed on high alert, and a special regime has been imposed on thermal power plant number 3. On Thursday, the Prime Minister visited the Ministry of Energy, met with senior officials, and issued directives. At the outset of the meeting, he addressed concerns raised during the cabinet meeting held on Wednesday regarding the duplication of functions and staffing within the civil service. He emphasized that such redundancy not only inflates the bureaucracy, but also diminishes accountability. Accordingly, he instructed all ministries to conduct thorough analyses of structural overlaps and staffing redundancies, and to implement reductions where necessary. Furthermore, the Prime Minister tasked cabinet members with outsourcing certain state functions to the private sector, reducing government involvement, promoting digitalization, and building a citizen-centric civil service. In this context, he was briefed on the current situation in the energy sector. Following the accident at Thermal Power Plant Number 3, JSC on June 2, 2025, the government issued a resolution stating that the plant's operations had resumed normal functioning. However, the government has assumed direct control of the company's operations and declared a 6-month emergency regime to mitigate potential risks. The resolution mandates the Minister of Energy, Choi Surin, to enhance the energy sector's readiness, ensure the stable operation of technical systems, equipment, and thermal power plant infrastructure, oversee timely implementation of scheduled repairs, mitigate potential future risks, and finalize winter preparations for the 2025 to 2026 season. It is imperative that the National Energy Commission, the National Council, relevant ministries, and agencies operate under a unified management system, stated the Prime Minister. He noted that while the specific cause of the accident at Plant Number 3 is still under investigation, disorganization within the sector's management has contributed to a lack of accountability, affecting the work of engineers and technical personnel. He added that persistent conflicts of interest and leadership disputes over the past 2 decades have hindered the progress of major initiatives, including the construction of the 5th power plant. The Prime Minister reiterated the importance of unity in management, policy, and operational principles. During the emergency regime at Thermal Power Plant Number 3, the Prime Minister announced that, under the law on the empowerment of the government of Mongolia, the state will directly oversee the company's core operations, administration, and organizational matters. A special plenipotentiary representative of the government will be appointed with full authority to represent and manage the company. The cause of the accident is expected to be determined within a week, and a comprehensive restoration plan will be developed. Preliminary assessments estimate that repairs to the building will cost approximately 7 billion MNT, while the transition to heat generation mode will require an additional 8.5 billion MNT. "I can't sleep at night worrying about winter preparations," said the Prime Minister. "And if I can't sleep, none of you should feel comfortable enough to eat." The headquarters of the Ulaanbaatar National University of Medical Sciences hosted a professional training session led by renowned psychiatrist Dr. Onur Burak Dursun, professor from Turkey, focusing on adolescent autism and attention deficit hyperactivity disorder. The training was attended by psychologists, physicians, and mental health specialists from all 21 provinces and 9 districts of Mongolia. During the session, experienced Turkish psychiatrists provided in-depth information on the symptoms, diagnosis, and treatment methods of autism spectrum disorder and ADHD. The training was prompted by a recent increase in the prevalence of these conditions. The experts stressed the importance of early detection and accurate diagnosis, particularly in adolescence. They also highlighted the need for coordinated efforts among psychologists, social workers, and families in managing these disorders. We have an ongoing international collaboration focused on consultation and training in child mental health. In Mongolia, we are working to develop a comprehensive training program for psychologists in partnership with local institutions such as the Ministry of Health and the National Center for Mental Health, whom we regard as close partners. I hope this initiative will significantly support Mongolia's mental health sector in delivering effective services and treatment. Dr. Dursun emphasized that addressing autism and ADHD requires not only proper diagnosis, but also effective treatment strategies and a tailored approach. He noted that training Mongolian specialists would enhance the ability to provide care to a greater number of children. The event marked a significant step forward in advancing research and treatment opportunities related to adolescent mental health in Mongolia. It also served as a platform for exchanging experiences and launching new initiatives aimed at improving care for adolescents and individuals with mental health disorders. This training not only introduced new knowledge and techniques for supporting adolescent mental health and improving the quality of life for affected children, but also laid the groundwork for ongoing and standardized training programs in the future.